are ready whenever you are.
Okay.
You guys can stop me in the door if you want
Thank
to
you,
come
Mr. Chair and members. First, I want to thank the chair, committee staff, and stakeholders for their hard work in strengthening this bill. I'm happy to adopt the amendments presented to you today. AB 263, the EMS Workers' Bill of Rights, will address a number of deficiencies in the emergency medical services field. For too many years, private sector emergency medical technicians and paramedics have been suffering from unfair working conditions that include a lack of rest and meal breaks and a lack of data around workplace violence. Data collection will help create best practices to avoid future violent incidents and ensure safety for workers. In a study by the labor centers at UCLA and UC Berkeley, researchers found that EMS employees worked 12 to 24 consecutive hour shifts without sufficient time to eat or rest due to high call volumes. This contributes to intense fatigue and burnout for EMS workers and compromises the safety of the public. Currently, EMS workers take their rest and meal breaks while on call, often confined to their ambulance vehicles on street corners or parks with little access to sanitary restrooms or food vendors. Additionally, workers are only able to take a rest or meal break whenever a free opportunity becomes available, which sometimes may never happen. AB 263 ensures that EMS workers get adequate rest and meal breaks and allows for interruption in the event of an emergency call or disaster. If an employer fails to provide an appropriate meal or rest break, AB 263 ensures that workers will be financially compensated. Second, EMS workers often deal with violent and traumatizing situations. This bill requires that the California Emergency Medical Service Authority to record incidents of violence against employees to better understand best practices for the future. Moving forward, I'm committed to working with any opposition on any outstanding issues. Here with me today are Jason Berloni, President of United EMS Workers Local 4911, Jamie Field from Local 4911, and Brian Allison and asked me to testify in support.
Welcome. Mr. Chair, members of the committee, Brian Allison on behalf of the American Federation of State, County, and Municipal Employees. Our affiliate, United EMS Workers, Local 4911, their president, Jason Berlini, and one of the members from Riverside County is here to give substantive testimony and talk about the issues that they deal with every single day on behalf of you in the communities that they represent. But I just want to take the time very quickly to commend the author, the chair, the committee staff for their diligence in working on this bill. I'd also like to thank the vice chair for his work with us to ensure that we're addressing critical issues dealing with communication devices, and his commitment to public safety is one that we also share as a union that represents these workers and provides these services across the state. We recognize that this is just the first step in what we believe to be a long process, but we think that this is absolutely critical that we stand up for the folks who are providing the critical services in communities across the state that are literally saving lives. It is our responsibility, and I would hope that the legislature would make it a priority to ensure that these workers who are doing work on your behalf have the adequate real meal and rest break provisions that they need, as well as the information that they need to begin to address some of the issues that they deal with in their memberships. But with that, I will respectfully request an aye vote from you all.
Thank you. Next witness.
Thank you, Mr. Chair and members of the committee. My name is Jason Berlini. I'm a paramedic in California, also the president and executive director of United EMS Workers. We represent about 3,000 private sector EMTs, paramedics, and support staff in California. What I'd like to take an opportunity to share with you today is our approach to dealing with mental health. And you may ask, why are we talking about mental health with language that looks traditionally like labor protection bill? And it's very important for the community to understand that when you look at suicide and mental health rates within our industry sector, suicidal ideation is 13 times higher than the general population. Suicide attempts and completion, 10 times higher than the general population. And when you look at the progression from new career to severe mental health issues, there is a clear and very articulatable pathway to that. And it starts with critical stress. Whether it be accumulative or acute, when that accumulative stress and critical stress is not relieved at the 5 to 11 year mark, depending on which report you look at, creates career fatigue and burnout, which progresses to depersonalization. And we have a period in our careers where we no longer can empathize with the patients that we serve, and we just flat out don't care. And when you get to that point, it does not take much of a stimulus to move to severe mental health issues. And so our organization has looked at this, and we have always supported back-end mental health services, awareness, the check on your buddy and your partner programs. But we've also realized that if we don't do something about the front-end critical stress, we're chasing our tail on the back end, and we're never going to win when it comes to mental health issues. So what this bill does for us is provide some respite for the day-to-day to reduce that opportunity for critical stress to rear its ugly head and get us to walk down the path of significant mental health problems. And I'd like to introduce Lisa LaRusso. She's a paramedic and a colleague of mine that can share a personal story of what happens when we do not manage this stress and the mental health issues that arise from it.
Hi, my name is Lisa LaRusso. I've been a paramedic in the private sector area for 27 years. I'd like to say is imagine responding to an emergency call as a private sector paramedic and a mother and seeing two children lying in a puddle of blood and mutilated by the hands of their mother, knowing that because of the severity of the act of violence that only one of these precious lives could be saved. Imagine seeing the destruction of these two small lives, doing everything humanly possible to save both of them, and then immediately having to respond to yet another call that could very well mean another life or death. That is the reality of our everyday. I'd like to give you an example of one of my coworkers who's been a medic for 35 years. He had two difficult 911 calls in one day in which he no longer could cope with in his mind. He had his partner stop the ambulance and got out and proceeded to stand on the train tracks and waited for the train to come. His partner eventually talked him off the tracks. He went back to the station and left work and has not returned. After coming up with several different scenarios to commit suicide, he did finally decide to try and get help through EAP, but they failed him and just wanted to prescribe medications. They didn't work. He just wanted to talk, but wasn't given the time. Workers' comp wouldn't cover him, and he was denied disability. He's been left with no insurance and no income. He turned to alcohol and marijuana to try and forget. It was cheaper and it was easier. He has come to the decision to tie up loose ends than just disappear and commit suicide. He has treated his PTSD as a terminal illness and has come to terms with it. He's no longer looking for help and has made his decision. This is the only way to stop the memories and the nightmares. The opportunity to help him was gone as soon as he walked out of the station door. If EMS workers aren't given more help to cope with these horrific calls immediately following them, then there will continue to be more suicides. EMS workers save lives, but nobody's saving us. We believe this bill is the first step in addressing these concerns. Please vote yes on AB 263.
Thank you for your testimony.